The virus reacts to different temperatures, climates, and surfaces. The findings confirm that the virus survives better in colder and drier environments and does less well in warmer and more humid environments. And then I see the disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that.
Let's go live to our US correspondent Cordelia Lynch in Washington. There have been more than raised eyebrows at these remarks from the president. Cordy?
Yes, absolutely. I mean, all I can summarise the response really to this is incredulity, condemnation, consternation. No one could quite believe that these were the words coming out of the mouth of the president. Time and again, he has said, I am not a scientist, and then gone on to make these almost declarative remarks about possible cures, possible solutions to this virus, which he is so desperate to reach. But many of the scientists and the medical professionals last night, when they saw this, said this is the very worst thing that you could do to your body, certainly in terms of disinfectant and ingesting it in any way. They have been at pains to say that that could cause severe damage to the lungs. It's dangerous, as you say. It is irresponsible. And in fact, we've also had a statement from the owner of the disinfectant Dettol, Rakit Benkisser. Let me just share that with you. In it, they say, as a global leader in health and hygiene products, we must be clear that under no circumstance should our disinfectant products be administered into the human body through ingestion, ingestion, or any other route. As with all products, our disinfectant and hygiene products should only be used as intended and in line with usage guidelines. It goes on to say, please read the label and safety information. We have a responsibility in providing consumers with access to accurate, up-to-date information as advised by leading public health experts. For this and other myth-busting facts, it actually provides the website. Please visit COVID-19facts.com. So you see a very lengthy statement from the company there. They're obviously deeply concerned by what the president had to say. And I think we saw, if not concern, then definite discomfort in the eyes of his scientist, Dr. Deborah Birx, a woman who has been by his side throughout these briefings. And you saw her sort of look to the floor and shuffle a little. It's very difficult to see the man that they are working alongside go up and address the nation in this way. What didn't come up was the 50,000 death toll from coronavirus that America now faces. Donald Trump was also pushing back on hydroxychloroquine. This was a drug that he was touting as a possible miracle cure. Well, now a study has come out that suggests that, in fact, of the patients that they looked at, this resulted in more deaths, not less. Just a little note, Jane, on that UV light issue as well. Now, Donald Trump says that this is a product of a research study that's been carried out in Baltimore. The man that he had on stage last night is actually a Homeland Security official. He is not a scientist, but this study purports to have put a lot of light into the virus. Donald Trump believes that means that hopefully sunlight may help to try and tackle coronavirus. Now, there have been some studies in China suggesting something similar, but critically, this research coming out of Baltimore has not been peer-reviewed. That means in the normal way that you would expect scientific research to be dealt with, there have been no other significant eyes on it. They would certainly need that. They would also need FDA approval if they were to press ahead with any of this as a kind of formal recommendation to the American public.
Cordy, thank you.